Okay, so my name is Andrew Bartlett. I'm a pharmacist and associate lecturer in the School of Pharmacy. I started doing my PhD a little over 12 months ago. So I'd like to acknowledge my supervisors, Dr. Irene Dr. Carl Schneider, and also acknowledge honours student Shalene Naker for help with data collection. And I'd like to present some findings from our qualitative study on preceptor and preceptee perspectives of assessment of pharmacy preceptors. So for those of you who aren't in pharmacy, the pharmacy world, preceptors are otherwise known as, in other circumstances, as clinical educators or clinical supervisors or tutors or some other roles of a similar nature. And so for background, preceptorship is a formal relationship between a practicing health professional and a student or graduate, with the preceptor being a role model, supervisor and facilitator of learning experiences and professional socialization. In pharmacy, we have preceptors involved in both short-term clinical placements during the undergraduate program, and then for a 12-month period prior to registration. And so in 2020, there was some new accreditation standards brought out that stated that program providers needed to provide high quality work and learning and practical experience, including resources and processes for appropriate supervision by competent, qualified professionals. And they should also be able to explain how sites are chosen and evaluated, including the supervision. And currently there's no appointment or oversight process for preceptors in pharmacy officially. So this has presented an opportunity for further work in this area to have a standard approach to this issue. So we conducted a literature review of the competencies of preceptorship in health professions, along with the methods of assessment, and published that review that outlined 16 competencies, and we mapped those to methods of assessment as the basis for an assessment framework. So having this base, we wanted to get the views of those with most at stake in this process, which is the preceptors and the preceptees who are taking part in the programs. So we undertook to do some focus groups to explore the views of preceptors and preceptees on the preceptorship experience, assessment of preceptor competency, and the ways that preceptorship could be improved. We employed a purposive sampling strategy, sort of targeting students, current interns, registered pharmacists from hospital and community, and both from rural and urban settings, and had a semi-structured interview schedule with recordings of all interviews or focus groups. And the interviews were then transcribed into NVivo 12. And a constructivist approach was taken to the thematic analysis, with themes being derived inductively from the data. So as a result of those focus groups, we had 56 participants taking part in 13 focus groups and 3 interviews. The focus groups and interviews produced a rich, multi-dimensional discussion amongst participants that elicited 7 themes that spanned the purpose of preceptorship, or the essence, if you will, things like guiding theory into practice and being a role model, expectations being shared between participants, some challenges and limitations. So challenges like having your employer as your preceptor, and variation in the experience, to what it is to be a preceptor, what motivates people, and what barriers such as time commitment might affect people being a preceptor. And then finally, views on assessment of preceptor competence. And so because this is the assessment stream of the mini conference, I just wanted to focus on that last section, which is the assessment of preceptor competence. And this theme included sub-themes of recognition and accreditation and acceptance of assessment. So recognition and accreditation are about validation. So being recognised, it's an internal validation to preceptors and a powerful motivator. And one participant was saying that they have these certificates and people actually hang them up in their dispensaries, and it means a lot to them. And the accreditation side is an external validation. So preceptees indicated that having an accredited preceptor would actually be a deciding factor in where they would choose to do their preceptorship. And some other preceptors were quite attracted as well, thinking that this would have them seen as a preceptor of choice to attract interns, often from rural areas where workforce planning reasons may be important to them. There may, however, be some unintended consequences. So one participant expressed the fear that accreditation may increase the quality of preceptors, but decrease the quantity. And then there was the fear that that might increase competition for places. So and then finally, acceptance of assessment. Preceptors almost universally accepted that evaluation was a good thing, and it was good to be evaluated by other people. They had different preferences for how they would like that to be evaluated, but generally it was seen as a good thing. And some preceptors even wanted to make those results public, and so that would be ways of having being seen to be a preceptor of choice and attracting graduates. So what is unknown is the minimum standard that would be acceptable, and that's our next step. So we have ethics to conduct a Delphi study to come to consensus on the competencies that we've already identified, as well as their minimum standards. And then some of the challenges that we have in our work to come is what would an accreditation process look like? And then what sort of implementation theory or approach should be applied? So thank you for listening. I've put my contact details on the slide if anyone likes to get in touch. But please, I'd like to hear your thoughts on those points.